Good afternoon. My name is Deborah Corey, and I'm the chair of Multnomah County. Nearly 8 weeks ago, the governor of Oregon issued a historic stay-home order designed to slow the spread of COVID-19. Most of us haven't experienced a disruption to daily life like this in our lifetimes. I want to thank everyone who stayed home so our community could keep the virus from spreading. And I am especially grateful to those who filled essential roles in public health, grocery stores, and health and human services to care for others. You've made a life-saving difference. Beginning tomorrow, the governor has ordered that retail and childcare that had formerly been closed, as well as summer camps, could reopen statewide. But for everything else, the counties must meet a series of metrics that will help us reopen carefully. These thresholds will help us to be able to respond to what happens when more people are back closer together. Everyone is anxious to reopen businesses and to resume activities. Every day, people are asking me, when are we going to get back to normal? But the reality is, until we have a widely available vaccine for COVID-19, we are not going back to normal. We have not beaten COVID-19. What we have done is buy ourselves time to educate ourselves and to prepare. But this is still a highly contagious and deadly virus that we've been able to slow only through significant sacrifices like staying home as much as we're able. And by relearning proven efforts like physical distancing and vigilant hand washing. We are all going to have to adapt our daily lives, expectations, habits, and routines for the foreseeable future. And we must be vigilant about where the disease is moving in the community and be ready to adjust. We must make sure that people of color who disproportionately work in public-facing jobs, who live in multi-generational households, and who are in communities with high rates of chronic disease due to lack of health care have equitable access. That means equitable access to testing, equitable access to primary care, and equitable access to support if they become ill and must isolate. We must make sure that people in long-term care, corrections, and shelter settings receive the care, information, and intervention they need to stay safe. If we open too fast, too much, this virus will only deepen already unacceptable health inequities and overwhelm the healthcare system. As of this morning, we've already lost 55 people in this county, and 940 people have become sick. And we know that that count only captures those who tested positive, but not necessarily all of those who have contracted the virus. My sympathies go out to the families of those who have become ill and suffered so much trauma as a result of this pandemic. From day one, my goal has been to slow the spread of this virus to save lives. The only way that we can reopen in Multnomah County in a way that safely and equitably moves every corner of our community forward together is with sufficient financial help. But right now, honestly, the help that we need seems out of reach. $1.7 billion has been allocated to regional governments in Oregon through the Federal CARES Act package. Multnomah County is home to about 20% of all Oregonians, but we have 27% of Oregon's cases and 40% of all the deaths. Yet we have received just $28 million. That's less than 2% of the total. As the public health authority leading our region through this pandemic and the largest safety net in the state, that is nowhere near enough. Let me say that again, it is not enough. The blunt calculations used to allocate this disproportionately small amount hurts the people of Multnomah County and risks undercutting our ability to reopen and recover safely. As part of any successful reopening, the federal government must provide more robust support. What gives me hope as we move forward is the strength of this community and the dedication of the people in this organization. With that, I'm pleased to turn it over to Multnomah County Health Officer, Dr. Jennifer Vines.
Thank you, Madam Chair. Dr. Jennifer Vines here under Chris Voss's login. You'll hear from him shortly. I'll echo some of what our chair just said in terms of where we've been, where we are, and where we're headed. Again, this virus appeared in our community, not from a traveler to China or elsewhere, but already in the community, meaning that it was here undetected for an unknown amount of time. But we had to quickly switch our response, having seen how it played out in some really difficult ways in other places like Italy, the state of Washington, and more recently New York City, leaving health systems overwhelmed and people losing loved ones unnecessarily to this virus. So under the governor's leadership and with support from Multnomah County, we did a painful but necessary step of staying home to save lives. So I would also echo the chair's gratitude for all of those who have upended their routines and their lives in order to save others, which there's no doubt in my mind we've done. So the slogan was to flatten the curve, and we most certainly did that. I think that's lives saved. And the models now for how this disease progresses are pretty clear, that if we cannot, as a community, keep viral transmission low, there will be more illnesses, there will be more hospitalizations, and sadly, there will be more deaths. So as we think about reopening, we have the competing demands of people wanting to get back to their jobs, understandably, worried about their finances, worried about the local economy. And we also have to think about health and how this virus spreads, and especially how easily it spreads. And specifically, I would point out that we have good reason to believe we don't have many people in Multnomah County yet immune to this virus. So we still have potentially a lot of people at risk of this illness and its consequences. So we need to really carefully balance reopening, knowing that COVID-19 will be more likely to spread as people mix and also as we test more people. So again, as testing comes online, we expect case counts to go up. So our goals really are that this situation doesn't overwhelm our public health system's ability to respond or our health system's ability to treat people with the care they need when they need it. So we need to make sure we continue to protect those at highest risk of severe illness. We now know clearly that that includes people from communities of color, the elderly, and settings like long-term care facilities, corrections, food processing plants. These are all high-risk settings for virus transmission, and so these are all specifically called out in the reopening plans. I will just add that even though we know that older people are more likely to get the severe complications of this illness and potentially die from it, it can affect any age, and we see that in our local data. And now, sadly, this week, we're starting to learn about the potential consequences in young children with new reports of what looks like a full body inflammation response to the virus that we think is rare, but that we have yet to learn more about. So again, proceeding with caution, I think, is by far the best plan. I want to acknowledge the vulnerability of people in our public-facing jobs, and you'll see sector guidance from the governor, but I would emphasize there's also a strong role for employer responsibility, both in protecting their workforce and in their clients, in protecting their clients. So the times ahead and the timing are uncertain. I will close with reminders of what you and I and everyone can control, and that is you can stay close to home, but get outside. Wear face coverings if you can't reliably maintain at least 6 feet of distance. That protects other people from droplets that you may have in your nose and throat and mouth. It also can protect you from others. If the mask is well made and fits your face well, quilting material, combinations of cotton and flannel, again, well sewn and well made, can offer the wearer a good amount of protection. And then always remember hand hygiene. So I'm afraid everyone may be tired of hearing this advice, but these are the tools we have at this point, again, with no vaccine, no treatment, and many people yet to potentially become ill. We have a real balancing act ahead of us, and I want to thank our chair, our public health leaders, and the community for how far we've come to date, and I'm with you here today in solidarity for what lies ahead. With that, I'm going to turn it over to Rachel Banks, our Public Health Division Director.
Thank you, Dr. Vines, Chair Corey, Rachel Banks, she, her, hers, Public Health Director. And since the beginning of this pandemic, we have been publishing data data so that you as the community can see the information that we're seeing, so that you can understand the disease patterns that we're seeing, and so that we can all track and monitor if this disease is disproportionately impacting certain people, so that we can design interventions and protect those vulnerable populations. Today, we're going to be releasing a new dashboard, a dashboard that shows how ready we are, how prepared we are to reopen and meet the state's criteria. This will be a weekly snapshot that we'll release every Wednesday, and it will show how Multnomah County is prepared to reopen. And in this process of comparing ourselves to every other county in the state, it has become very clear that Multnomah County is not like any other county. We are unique because of our population. We're unique because our diversity. We're unique because our density. We're unique because the size of our health systems, the amount of first responders that we have, and the interwoven tapestry of trusted social service providers that make our county whole. So our dashboard includes state metrics, but it also includes additional metrics that your public health department thinks are important for us in moving forward. So now let's get to the dashboard. As you can see, Multnomah County has met 3 of the 7 requirements that the state says that we need to meet to enter into phase 1. And we've met 4 of the 5 requirements that our health system needs to meet in order to move into phase 1. And our health region includes Multnomah, Clackamas, Washington, Clatsop, Columbia, and Tillamook counties. We've made significant progress on all of the other areas, and we're going above and beyond to assure that our community is monitoring 3 additional metrics that affect communities of color and other vulnerable populations. So now I want to talk to you about the areas of work that we've been working really hard on and that you may have heard about. Multnomah County has case investigators who track communicable disease, and that's our core work. That's the work that we do every day. Part of that work is to reach out to every positive case and try to find out where they've been, who they've been around. And then we have contact tracers that follow up with those contacts and give them information on their symptoms, what to watch out for, and ultimately guidance on staying home and staying isolated. We've done this with a variety of other diseases, most recently measles, and we were able to contain the spread of measles by using this proven approach. The issue is now with this virus, it's different. And I want to explain to the public that our public health contact tracers or case investigators do not have police powers to compel people to talk with us. That's why we need trusted community members, folks with impeccable customer service, a commitment to protect the public's privacy and build trust. And we rely on you all, and we rely on the public to cooperate with us. That's why it's so important that we're building an expanded workforce that has the lived experience, the cultural experience, and the linguistic skills to talk to people to ensure that we can follow up with them in a timely way. The next metric is contact tracing within 24 hours. And this is a new metric for us. We've been able to reach 75% of folks that we're trying to contact within the first 3 days. And we are gearing up, changing our game to meet this new metric. Once again, because of the underlying health inequities that we've seen and the data that shows the disparities in COVID-19, we need a culturally specific and matched workforce so that we can reach out to people and talk to them in a way that they feel comfortable with, that they trust, in a language that they speak. And all that needs to be in place so that we can reach folks within 24 hours. So finally, I'll turn it over to my colleague, Chris Voss, Director of Emergency Management.
Great, thank you, Rachel. Just a few things. I was going to go over some of the other metrics that Rachel did not actually address. The next one on the list, if you scroll down through our dashboard, is healthcare capacity. And we work regularly with our healthcare institutions as well as the Health Preparedness Office that have certified this next criteria as met. And I'll probably spend a little bit more time talking about PPE. PPE will continue to be a very important part of reopening. First, I want to say we're close to meeting the PPE for first responders. We've asked for specific information from each organization that works in the county and have been collecting that data. As you probably know, a few of these responders actually report to the chair, so it's information we've needed to collect, and that's what we're doing in that area. We've also included criteria because we want to be upfront about the social service providers and others that are very important to the county. This last criteria addresses specifically this. From TriMet to home health care, there are numerous other organizations that are relying on Multnomah County for their PPE right now. PPE for hospitals and first responders is just one component. When organizations have less than a week's supply, they provide a critical resource to the county. We receive their requests and process their PPE. In the last 2 days, we've received 33 requests, and in the last 2 weeks, over 300 requests of PPE. That means there's 33 organizations in just the last 2 days that were not able to receive the supplies they need and stay open using the current supply chain. And while we're happy to help out with these supplies, we want to know that our resources are limited. We want to acknowledge that these organizations are also critical and that the normal supply chain is still not able to provide everybody with what they need. Thank you.
With that, I think we can take some questions. If you want to raise your little blue hand, chat us in Zoom. You can, sorry. Oh, right. You can chat us in Zoom, or you can text your question to 503-502-2741. And for folks on the phone, I just ask you to remember to mute your phones. And if our speakers could just repeat the question if we get something over the phone. Zane Sparling, this is for the chair. Does Chair Kafori have any estimate of what day the county will reopen?
I know that everyone is anxious to learn when we're going to reopen. I know that my own children ask me every day, when are we going to reopen? The truth is that Multnomah County is not ready to reopen. We actually will have a test coming up tomorrow, Friday, May 15th. The governor has ordered that all retail that had previously been closed will open, and childcare that had previously been closed is allowed to open. So this gives us our first test case to see how having a new amount of people, greater amount of people out using transit, walking the streets, entering facilities, how that will affect the numbers that we have here in Multnomah County. And then we have a dashboard, our new dashboard that we just unveiled today. That dashboard will give you the opportunity as a community to see exactly where we are in meeting the governor's criteria. That dashboard will be updated every Wednesday, so you'll have an opportunity to see how close we're getting to be able to be at the point of opening. I think it would be irresponsible of me to give you a date at this point because we don't yet know, and I don't want to set unrealistic expectations for the public that it's going to happen tomorrow or next week or even anytime in the near future. That being said, we are working very hard to ensure that we can get the PPE necessary to reopen, that we can get the contact tracers on the ground, trained up and ready to do their job so that we can reopen. We just want to do it in a way that's safe.
Thank you, Chair. We've got a couple questions. First from Jonathan Bach and then Blair. Jonathan is asking, will Multnomah County apply to reopen before or after the equity parameters are met?
Multnomah County is committed to addressing the equity parameters that we outlined in our dashboard. We don't believe that we as a community want to reopen despite the impacts that it's having on very vulnerable people in our community. So we will be tracking very closely. It's our priority, our goal, and we're working towards having plans in our communities of color that give them the necessary support, the necessary PPE, and the necessary services so that they can be safe throughout this pandemic.
Thank you so much. And Blair with Mercury is asking, perhaps Rachel, thanks. How many more contact tracers does the county need, and when will they be hired?
So thanks for the question. We've quadrupled the amount of contact tracers and case investigators that we have. The state, based on the state's calculation of 15 per 100,000, we would need 122. And we are going about that number, taking into consideration that we're gonna hire folks onto our team here at Multnomah County Health Department, but as well be working with community health workers in community-based organizations and working with community-based organizations. At this point, we have about 35 of them in place, and we are recruiting. We're in the process of recruiting to scale that number up.
I'd like to add one point to that, and to hire all of these vital, crucial contact tracers and the supports that go along with it, it costs money. And we, as I've said during my statement, we only received $28 million from the federal government. So that's not enough to do the job that we know we need to do. So my board, the Board of Multnomah County Commissioners, and I are going to be talking next week. We have to make some really tough decisions about where we're going to find those dollars. And those dollars are critical if we're going to reopen our community.
Thank you so much. Let's see, follow-up question on that from Jonathan. Will Multnomah County apply to reopen? Oh, right. Sorry. Need 122 total or an additional 122 contact tracers?
We will need a total 122 contact tracers for the state's calculation.
What's that? Yeah. Do you want to, we got a question from the member of the public. Are there plans to do a community antibody study to get a better idea of the % of the population which has been exposed to the disease? Maybe Jen Vines on that?
You're on mute.
So I would say Multnomah County does not have plans to do that kind of study. A study like that would take place almost certainly at the state level. And so Oregon Health Authority would be the best person to ask.
So if anybody has any more questions, any blue hands or chatting? And I don't think we have anybody on the phone who has questions. Right. Oh, we did get one question. Wondering if Multnomah County is planning to open on its own or if they want to open as a region.
I'll answer that. We've been in constant close contact with our partners in Clackamas and Washington counties. We know that in our region, the number of people who live in one county and work in another and recreate in yet another county is vast. The geographical boundaries really are not very strong here in the Tri-County region. So we've been working very closely together. That being said, we are still different counties and maybe meeting these metrics at different times. So while we want to open in a similar time frame, I can't say that we will actually open all together on the same day.
Sorry. As we sign off. Okay, so if hearing no more questions, we would just remind folks that they can go to the county's website on coronavirus. It's multco.us/novel-coronavirus-COVID-19. And in the upper right, you'll see Reopening Multnomah County, and that'll give you the updated weekly numbers. Thanks so much, everybody, for joining us. Stay well.